evening. You are tuning in to Focus on the Family Malaysia's Facebook Live event on understanding your teen's mental health, where we will uncover what depression and anxiety can look like for a teenager and how parents can best support their teenage children that may be struggling in these areas. It is not breaking news that our teens are increasingly struggling in the area of mental health. Our National Health and Morbidity Survey in 2019 reported that older children ages 10 to 15 showed a higher prevalence of mental health problems than younger children ages 5 to 9. This is consistent with WHO's report that 50% of mental health illnesses begin by the age of 14. So that is why here at Focus on the Family Malaysia, we want to support families and parents through this journey in supporting their children, and also by increasing awareness on teenage mental health. If you have a teen at home or if you are working with teens, you would probably have some questions. Please go ahead and ask those questions in the comments section. And we have allocated time for a Q&A segment with our panelists. So when you are asking a question, please include the age of the teen because this would help our panelists give an age-appropriate answer. Speaking as your host tonight, my name is Dorothy, and I run the youth department here at Focus on the Family Malaysia. Joining me this evening are three mental health professionals. We have Dr. Vincent Wong, consultant psychiatrist, Ms. Lo Sit Fong, a clinical psychologist, and Mrs. Tan Ah Eng, a family counselor. Thank you, Dr. Vincent, Ms. Lo, and Mrs. Tan for taking time to be here with us tonight. We have quite a bit to cover. So without further delay, I'm going to jump right in. We are aware that children will have some behavioral and emotional changes as they go through puberty, entering into their teenage years. So Ms. Law, what is considered normal psychological and social development of a teenager?
Teenager or adolescence is the transition period from childhood to adulthood. Normally, it is referred to the ages between 13 to 19 years old. This is the period teenagers experience puberty and sexual maturation, where teenage girls have their menstruation and teenage boys experience change of voice, among other bodily changes. The psychological impact of puberty is that girls are more critical of their appearances and are likely to be dissatisfied, especially when their friends often discuss about appearance. And cognitively, teenagers also develop more logical and abstract thinking, moving on from the concrete thinking developed in childhood. As a result, they would begin to reason and also question more about different aspects of life and ways of doing things. So this might be the period where teenage children would voice their opinions on different topics more. Teenagers is also a stage they struggle with their identity and their roles. Their task is to solidify a sense of self by testing and also integrating various roles that they play. Yeah, for example, the role of siblings, the different roles that they're playing at school, being a prefect, maybe being a committee member in a certain club, and also being a daughter or son. So example, a teenager who is outgoing and have many friends versus a teenager who is more introvert and have a few close friends, they need to come to a sense of accepting themselves as who they are. So peer acceptance are important for teenagers, and they are heavily influenced by their peers. They like to belong to a certain peer group, or they strive to be popular. So there is also the risk of peer pressure to conform negatively during this stage. Nevertheless, the task of achieving one's identity would take longer than adolescence period to accomplish. The task could even extend to young adulthood.
Wow. So, Miss Law, hearing from what you're saying, a lot actually goes through for a teen entering into from adolescent entering into teens, because physically there are changes, and for girls especially, they become more critical about their physical appearance, and then intellectually there's critical thinking, which causes them to question, and even they may in a way seem to parents that they are challenging what their parents are saying, challenging values at home, challenging boundaries. But because this is because of their cognitive thinking that is developing. Then socially, I also hear you say that peers become so important to the teens, because they would feel that I need to be accepted, I need to find a place of belonging. And in that scenario, I can just imagine parents maybe wondering, like, why are my children, always going to their friends, spending more time with their friends? But if we can say that this is actually normal, is normal teen development, right, Miss Law?
Yes, yes,
Mm.
indeed. Yes, Dorothy.
Okay, thank you, Miss Law. Now that we've heard from Miss Law on what is healthy psychological and social development of a teen, Dr. Vincent, how do we identify the differences between regular teenage ups and downs versus significant mental health issues? And what are the early signs that parents need to look out for?
Thanks, Dorothy, for the question. Good evening, everyone. Um, thank Focus on the Family for inviting me to share tonight. First of all, I'm in the middle of this parenting because I have two children, and one is in their teenage years, and another is in his preteen. So in the middle of this challenge. Well, what are the normal teenage up and downs? Well, thanks to Sid Fong for already giving a very good background info. Just want to um, enlighten that, parenting teenagers can be smooth sailing for some parents, while it can be extremely tough and very stormy, like a roller coaster ride for others. I will liken the emotional development and the thinking faculty development of a teenager like a sports car. They have their thinking faculty, which is developing in terms of reasoning skills, and they become more assertive and more argumentative in some ways. And their emotional development, because of the hormonal changes, it can be more emotionally intense, irritable, or easily annoyed. So like a sports car, you have a very powerful engine as the emotion, and you have the brake system and the steering wheel as the thinking faculty. Sometimes the engine is so powerful that the brake system is not able to regulate so well. So we parents have to journey with them. Now, for the second question, what are the early symptoms or signs of mental health issues? I come across many teens in the course of my practice, and just to name a few, number one is look out for any change of behavior compared to their previous self. For example, some of them may be more quiet, more isolated. They tend to spend more time in their room, looking at computer or their mobile phone. So take note of that when they are withdrawing themselves socially. Number two is to look out for the intensity of their anger outbursts. A little bit of anger, occasional annoyance is normal for any teenager, even as adults. However, if the anger intensity goes into highly intense, uncontrollable anger outbursts, where there's usage of foul languages, throwing things, breaking things, or physical fights, this is something that raises a red flag. Thirdly, is if there's presence of persistent low mood. I would say it's persistently low mood, like for many days or even goes on for weeks. Tearfulness or crying on their own, something that we need to look out for, whether they have depressive symptoms. Another is their anxiety symptoms. If they become more fearful, more worrisome, they tend to avoid friends or avoid going to school. And these are signs of anxiety symptoms. Another very important is any presence of self-harm or self-injurious behavior. And I must say that I've been seeing more and more incidents like this in my practice. And last but not least is usage of alcohol, smoking, vaping, or drugs. Definitely, raise a red flag. So the key take-home message for this is we as parents, we need to keep learning and equipping ourselves. I like this phrase that says, the eye do not see what the mind do not know. The eye do not see what the mind do not know. So we have to equip ourselves. Number two is to have that strong bond with our children, so that we need to be both a parent as well as their best friend.
Wow, thank you, Dr. Vincent, for all that wisdom, yeah, from the analogy of the sports car having strong emotional engine and versus the intellectual faculty of the drive, the steering wheel and the brakes, that shows that our teens still need a lot of guidance from the parents, which makes that relationship with the parents so important during these teenage years. And there are some things that I noted what Dr. Vincent has said. Just to recap a little bit, look for outbursts or sudden change of behavior, like extreme change of behavior. For example, throwing things, for example, physically harming themselves, and also persistent low mood. So it's the persistent and the extremeness of it. That's what I'm hearing, Dr. Vincent, right?
That's right. Yeah.
All right. And also definitely if they are starting to avoid and pulling themselves away from having social withdrawals, that's another thing that Dr. Vincent has also highlighted that we need to look out for, because as Ms. Law has mentioned, peer acceptance is something that is normal for them. So if they start to withdraw from their peers, then that is definitely a red flag. So now, moving on to the next question, right? We talked about parent-child relationship. Dr. Vincent talked about that. So the parent-child relationship plays a huge role in the psychological and social development of a teen. And there are parents that continue to maintain a close relationship with their teenage children. Yet those teens may still experience mental health issues. So Mrs. Tan, how do we make sense of that?
Thank you, Dorothy, and good evening, everyone. Now, we all agree that the parent-teenager relationship is very important and vital to support the growing teenager. And yet, I believe that as parents, in many ways, we need to remember that even for the most caring parent, there are many things that are out of your control. You know, on top of the environment and genes, your teenager is going through many changes and many challenges in a very short period, as they are, in counseling, we call it individuating, becoming an individual as themselves. So your teenager's temperament and unique personality are important factors to consider too. You know, this debate about nature and nurture continues, but especially today, you know, as we look at the many variables that are open to your teenager, and your teenager's extensive use of devices today opens up many new worldviews and unfamiliar perspectives. So the teenagers' connections with many others expose them to many, many views. And so while at home, they are hearing your voice or one or two voices of the parents, they are also hearing many other voices outside that are claiming their loyalty. You know, this is the double-edged sword, I call it, because while the devices allows your teenager to connect, it can also make your teenager feel very alienated and alone. And this can sometimes lead to extreme peer pressure, we mentioned just now, and social anxiety. But you may notice, even as your teenager goes through this, that a teenager who used to be very open suddenly becomes very withdrawn, very hard, very closed up. And this is a defense to protect themselves from hard words and injustice. This could be real, this could be just perceived. You know, teenagers tend to compartmentalize and deliver according to what they perceive is acceptable, expected, and important. And during this season of their life, belonging, connections, and being someone, these are things that are very important to a teenager now. So as parents, it is good to remind ourselves that while parenting can be joyful, it can be hard. I think Dr. Vincent mentioned this just now. For some of us, it's easygoing, but for some of us, it could be hard. And so because, remember this, because you love so much, you worry much too. And so many of us as parents, we carry a lot of emotional baggage. And this emotional bag or this emotional luggage of guilt is something that many parents live with or struggle with. So as parents, learn to remind yourself, let it go. Remind yourself that it's not your fault, that you are not a failure as a parent when your teenager struggles. So continue just being present, continue being loving, supportive to your preteen or your teenager as they explore independence, self-sufficiency. Continue to lovingly reach out, even when your teenager seems to be pulling away. You know, you see this picture that we have in our background, this teenager with this big box over his head, you know, all the mother thoughts and feelings. And as a loving parent, as you sit with your child, you know, I hope that you'll be able, as you lovingly come alongside your teen, you're able to open some windows into that box to understand your teen better.
Thank you, Mrs. Tan, for sharing that. I think that's also an encouragement and affirmation for parents that are tuning in tonight, because it really, there's only so much that is within your control. There are so many other elements that play a role in shaping your child to who your child, the teen that your child is today. But the very fact that you are here today, like what Dr. Vincent has said earlier, the eye doesn't see what the mind doesn't know, is it? Right, Dr. Vincent? Correct. The eye doesn't, okay, yes, you heard me. Yeah, you heard me that time. So we need to first know what we need to look at. So the fact that you are here tonight means that you are looking out. You are looking out to equip yourself to do better for your child, and that itself is commendable. So if you have just tuned in to listen, welcome. We are here tonight with consultant psychiatrist Dr. Vincent Wong, clinical psychologist Ms. Lawsit Fong, and family counselor Mrs. Tan Ah Eng. And we are addressing depression and anxiety among teenagers and how parents can best journey alongside teenage children that may be struggling in these areas. Our panel speakers will also be taking questions from the audience. So if you have a question regarding mental health, please ask them in the comments section. We will compile them for the Q&A segment later. And remember to include the age of the child in the question. All right. So Dr. Vincent, when we first approached you with the idea to address the issue of mental health among teens, your recommendation was to look at depression and anxiety for a start. Perhaps you can share with the parents tuning in right now, what made you say that?
Well, anxiety and depression is some of the common presentation that we can see that shows up. So it's just like a tip of the iceberg. So, you know, at the tip of the iceberg, you see their fears and worries and anger and sadness. But beneath the surface, there is a lot of personal issues, family issues, or school issues, you know, that's going on that we need to uncover, we need to unpack. So therefore, today we start off with talking about this more common conditions, anxiety and depression, but there are other not so common, but it does, we know it's becoming more increasingly more, as I mentioned, self-harm behavior. Yeah, it's getting more in terms of prevalence. Second is eating disorders. You know, I'm seeing more, you know, nowadays, and eating disorder, or we call anorexia nervosa or bulimia. Yeah.
All right, Dr. Vincent, then what are some causes of depression and anxiety among teens?
Yeah. Thanks for these big questions. Yeah, I definitely don't have time to uncover these highly complex questions, you know, in terms of the causes. You see, the causes of anxiety or depression is so complex and is multifactorial. Yeah. As what Madam Mrs. Tan Ah Eng just now alluded, you know, it's genetic and environment factors. Yeah. So in a nutshell, it's nature and nurture. So nature will refer to the genetics of a child, the genetic makeup. So what do you mean by genetic makeup? Meaning that every child is born different. You know, they come with different sets of temperament and basic personality. Yeah. And what kind of temperament that we know, you know, in simple terms, we can categorize into the easy child, easy and compliant child, that parents just really don't need to fuss, you know, during their growing up years. Yeah, just you know, they are so obedient and good boys and girls. Then you have the other extreme, the strong-willed child, yeah, which give you that, you know, that moment, that, you know, that years of stormy and roller coaster, and they rebel, they are argumentative, they retaliate, yeah, they run away from home, yeah. So this is the genetic makeup. Then we talk about the the nurture part, the environment, yeah. So I'll just highlight three important areas of nurture that could cause mental health issues. Number one is family issues or family dysfunction. Let me put it as I put it directly, yeah. And let's begin with fathers, you know, and we know that nowadays the demands of work is huge, and a lot of fathers or even and also mothers have to work, yeah, and to make ends meet. And sometimes we're so busy building career or business, and we have less time for the children. You know, leave them to the nanny, to the kakak, or you know, or sometimes with the grandparents. If the grandparents are nurturing, then well and good. So sometimes parents, especially fathers, can be physically present but emotionally absent in our children, and we become less involved in their growing up years, and we just miss the, you know, we just miss the boat, yeah, and that's very sad, yeah. And that is some degree of neglect. I call it emotional neglect, when we miss, you know, to be involved in their life. Then you have the second part, the peer pressure, yeah, the second causes, the peer environment. For example, like children or teenagers who couldn't fit in to their peers, as what Sit Fong has shared just now. You know, they feel out of place. You know, they feel don't have a place to belong, and they really struggle, and they don't want to go to school. You know, they feel ostracized or discriminated. Then, of course, another big issue is bully. You know, presence of bully in the school can be physical, or it can be cyber bullying. Now, you know, the online classes, social media, cyber bullying is very common. And last, the third causes is any evidence of abuse, or any evidence of abuse or neglect. Abuse can be in the form of physical, verbal, emotional, sexual. Yeah. What I mean, as parents, we are all well-meaning parents. You know, we don't abuse our child. Of course, we think that way, isn't it? But sometimes we didn't realize that our parenting may be a bit too harsh. You know, maybe a bit too. We want the best for them, but sometimes we get a bit too harsh. You know, or using words like, you know, like very negative words. You know, and which is unhelpful. Sometimes it can be condemning. You know, can be shaming, and also when parents compare children with other people, and this is very damaging to the emotional well-being. So in a nutshell, you know, it's a genetic and environment, and the environment is the family issues, peer pressure, and any abuse in the family or environment.
Thank you, Dr. Vincent, for giving such a clear example and such clear points on what can cause and lead to depression and anxiety among our teenage children. And I think what's important here is to again hear that we're not here to assign blame. We're not here to point fingers and like who's doing what, but we're here to create awareness. We're here to say that these are some of the factors that do contribute to depression and anxiety. So perhaps the question to ask and to reflect upon from tonight is, what are we going to do with this information now that we have this awareness, right? So now let's move on to the next question. I believe it must be hard for a parent to take in the news that their child is struggling with the area of mental health. Ms. Law, how can parents journey with their teen?
Yeah, Dorothy, that's a good question. As parents, it is not always easy to know what signs to look out for. And if you do have concerns, it can be tricky also to know exactly what to say to your teenage child and where to go if you are seeking support. Yeah. But if parents spot the warning signs of depression, anxiety, or other mental health problems, it is actually vital that they have a conversation about the issue before it escalates. Yeah. Research has actually shown that 1 in 5 young people experiencing psychological distress felt they didn't have someone they could turn to in a crisis. So once a parent noticed mental health red flags in their teens, so it's good for them to make sure, the teens feel supported and then they are there to be with the teens.
So, Miss Law, does that mean, right, that it's not so much about what you say or how the conversation goes, but it's a matter of starting that conversation? I think it sounds like that's very important for a teen.
Yes, Dorothy, you're right. Actually, parents can use conversation starters like, for example, because sometimes it's very difficult for parents, they don't even know how to open up the topic with their teens. So what they can do, they can say, I have noticed you are, and then list the specific behaviors that they notice. For example, I have noticed you are spending more time alone in the room, or I have noticed that you are sleeping more, or teary, or angry. So I'm concerned and would love to find a time to talk about it. And when parents start to talk to their teenager, it's important for them to make an effort to listen rather than offering advice or solutions up front. Yeah. And another conversation starter could be, what's the hardest thing about being you at the moment? This is a very powerful way to let the teenagers start talking about the struggles that they are having. And then parents can listen. And from there, parents can kind of like ask more specific questions about, oh, this is what you are struggling. Can you tell me more about it?
So it sounds like it's really important that the position that the parent is taking is just being curious about the child, to just find out more information from the child, like really, really good tips. Yeah, I have noticed you are. I'm just repeating this so that parents, you can quickly write that down. Yeah, very important question. And then what is the hardest thing to being you at this given moment? So these are two questions that we can use to even start such conversations with our teenage children. Thank you so much, Ms. Law, for that very good tip.
Yes, Dorothy, let me just kind of like sum up what you were saying. Instead of providing a solution to the issue, trust that, your teenage children understand the issue better than you at this stage, because they are the ones who are experiencing it. So ask questions, be curious, like what you said just now, and then reflect back how they are feeling. And then check your understanding by asking them, is this what you are going through? Is this what I'm getting, what I'm hearing from you? Ask what they have tried already. So if they have any ideas about what to do about the situation, then only then parents can inquire if the teenage children would like some help coming up with more ideas for dealing with what's going on. So the key thing is that they are in the decision-making driver's seat, but so teenagers know that they are in the decision-making driver's seat, but they also know that the parents are with them in the passenger seat.
I love how tonight we're using a lot of car analogy. Just now, Dr. Vincent gave the emotional engine and then the steering. And then right now, Miss Law is saying that the parent, you are the instructor, you are the driver, you're actually coaching your child how to manage the situation, but by first listening in closely to what your child is saying, and withholding that turn left now, turn right now. But it's really listening and trusting that your child knows where he or she is, what he or she is doing. Wow, this is so good, so good. Thank you, Ms. Law. Thank you for sharing this very practical tips to help. Remember, parents, listen. All right. Now, let's be honest, right? There is still this huge stigma when it comes to seeking professional help, because people often think that it's only when the situation is severe that you need professional help. So, Mrs. Tan, when should parents consider bringing their teen to seek professional help?
Thank you, Dorothy. I think just now, both Dr. Vincent and Ms. Low have mentioned the red flags to look out for. And so parents, while we learn to accept that it's normal for teenagers to have low moods on some days, and that it is okay not to be okay on some days. But when you notice that there is prolonged sadness, prolonged withdrawing from family and friends, and when your teenager has anxiety over normal things, normal tasks, and there is sudden weight loss or weight gain, and you see indications of self-harm, I think then it's time to actually sit down with the teenager. And as Ms. Law said, let the teenager have a say. Said, shall we consult someone or talk to someone? You know, and then proceed to actually find out, look out for some help that a teenager can go to. Yeah. And I think that will be the best thing to do, because just getting the teenager involved in the decision making, but also reassuring the teenager that if we go and seek help, all right, the person you're talking to will keep everything in confidence, that there is no stigma in seeking help. Just like telling your teenager that if you are sick with a fever, if you have a bad stomach ache, I'll take you to the doctor. And right now, I think maybe we need some guidance. We need some help. So putting it this way removes the stigma somewhat.
I really like how, even from Dr. Vincent, Ms. Law, and Mrs. Tan yourself, how you are painting this journey that I hope the parents can already see, that it's first listening into the parent's role, is first listening into the child and to observe the child and listen for cues, listen for symptoms, then inviting the child, giving that child even that responsibility to say that, would you like to speak to someone about this? Just inviting the child, giving that space for the child to make the decision, because I think that's important. A lot of times we think that, oh, because you are the problem, because this child is a problematic child, therefore I'm sending you for counseling. I think that's just going to cause so much more burden to a child. But the way that the three of you have painted this journey is that it's listening and seeing the child where the child is, and then helping the child, guiding the child along that journey to find help, to recovery. Thank you so much. So in seeking professional help, right, there are different professionals working in the area of mental health. For example, counselors, clinical psychologists, and psychiatrists. The question is, which mental health professional should parents seek help from? Now, the interesting about tonight is we have all three represented here right now. So if we could help the people tuning in right now to understand what your individual roles look into and what kind of help parents can expect to receive from a practitioner like yourself, I think that'll be great, right? So let's start with Mrs. Tan. As a family counselor, what can parents expect from you?
I think when the parent comes with the child or the teenager to see me, very often I just sit with them, listen and listen. I do not offer solutions. Once I had an 11-year-old boy who came. The first session, he didn't want to say very much, but I sat with him. I just sat there quietly with him. And the parents told me that they had taken him to a psychiatrist, but they did not want him at this age to start on medications. And so that is why they wanted him to talk to me. And thankfully, by the middle of the first session, he started speaking a little. And then the second and third sessions went on quite well. But being an 11-year-old preteen, of course, you don't expect a lot of conversations, but we just sit there listening, even in the silence. I think we can hear some things. Yeah, so we actually are there to provide a non-judgmental, a supportive presence to listen. Not to offer solutions, but to listen, to find out how the teenager can move on, to provide some coping skills perhaps later.
Thank you, Mrs. Tan. So now let's hear from Ms. Law. As a clinical psychologist, what can parents expect from clinical psychologists?
Yeah. Yes, Dorothy. I'm also trained in doing family therapy. So clinical psychologists would offer psychotherapy, and there are different models of psychotherapy. So what I practice would be family therapy, cognitive behavioral therapy. So what do we do in these two different models of psychotherapy? So in family therapy, so the family would come together, and I would actually help them to understand why the mental health issues, why those symptoms, whether it's depressive symptoms, anxiety symptoms, where they are coming from. Could it be, from the system itself, the family system itself, the emotion system itself? Could it be certain dynamics which is happening in the family that is also causing the distress in the teenager? Yeah. And that would be my first approach. And the second approach would be more like skills training. So let's say if the teenager is not able to regulate his or her emotion, so we will teach them how to regulate their emotion. And if it is about teens relationship, they have problem interacting with the other teens, so perhaps we can look into what are some of the interpersonal skills that they can also learn. So it's skills training. And I want to say in the event that I mean, clinical psychologists, if we think that, hey, skills training is what they need, and that would actually help them with the issues that they're struggling with, and also will help them to have relapse in the future if they face certain challenges again, then that would actually solve the issues. Yeah, but in the event that the situation is, the symptoms are really severe, for example, there are even suicidal kind of ideations, and that might be the time that we would refer these teenagers to get psychopharmacological help from our psychiatrist colleagues.
Okay, thank you, Ms. Law. Now, let's finally hear from Dr. Vincent as a consultant psychiatrist.
Thanks, Dorothy. I suppose most people don't want to come and see me, and it's seeing a psychiatrist. Some may think that, oh, I'm not crazy, and I think the time has kind of passed, for the society to be more aware that there is a role for a counselor, a role for clinical psychologist, a therapist, and a role for a doctor or psychiatrist. Well, but of course, those who come and see me, usually most of them are already quite moderate or severe anxious or depression, or they may be suicidal. Yeah. Actually, Mrs. Tan has already highlighted, the degree, then how long they have been unwell. So sometimes I summarize it into 3D. Yeah. First is the distress. Number 2 is the duration. How long the condition has been going on. Yeah. And the third is the dysfunction. Whether the parents begin to see that child is not able to function in terms of personal care or self-care, personal hygiene, or in terms of social functioning, with their peers or family, and their academic functioning, in terms of their studies. Yeah. So the 3D, yeah, distress, duration, and dysfunction. Usually for mild conditions, I would sometimes I also see psychiatrists, me as like a conductor, so they come to me, and then I'll see how some may need counseling. I will actually refer them to counseling. Mild anxiety or mild insomnia, I'll say, you go for counseling first. No need to start the medical treatment. But if they are moderate to severe in fear, panic attacks, or severe depression, suicidal, or self-harm, then sometimes I may refer to a clinical psychologist who do certain specific therapy. Yeah. And sometimes if they need medication, if they're in severe symptoms, then unable to function, they could hardly sleep 1 or 2 hours, then I will have to start them on medication to give them the symptom relief, and then subsequently see if they are able to, if they can verbalize well, they can express themselves well, I will then refer them back to their counselor or psychologist. So basically, I think that is in a nutshell, that's about it. Yeah.
I think that's really helpful, Dr. Vincent. The 3Ds: distress, duration, dysfunction. So if we could just see like it as low, medium, high, the levels, right? So it sounds like we're not saying that one mental health profession is more important or is better than the other, but we're saying it looks like all three of you do play different roles and specific roles. For counselors, they provide a safe space for the person to actually express themselves, so they listen in that safe space. And as for clinical psychologists, what I'm hearing is that they provide therapy. That means because the condition is a little bit more severe, that they need more intervention, skills training perhaps. And finally, a psychiatrist like Dr. Vincent will be to prescribe medication, because it's really they really need medication to rebalance some of these chemicals in their brain, right, Dr. Vincent?
That's right.
Okay, so let's move on. Yeah. So today's content was focused upon raising awareness on depression and anxiety among teens. Mental health professionals like Dr. Vincent, Ms. Law, and Mrs. Tan do intervention work. However, we believe the saying that prevention is better than cure still stands. So, Dr. Vincent, one last question before we move into Q&A. What preventive measures can parents take to build resilience in their children?
Thanks again, Dorothy. This is a very important question. Yeah. What are the protective and factors to build resilience? I'd like to liken the protective factors is like building an emotional garden for our teenager. So how do you tend to your garden? You need to provide a good soil, with a good soil, fertilizer, lots of sunshine, and a lot of water, right? So remember the emotional garden of a teenager. Now, let me share one survey done in US, which they survey this 4 key moments that parents need to spend with their teenager, right? This is a survey called the longitudinal study of the adolescent to adult in US, and they notice that when you spend these 4 key moments with your teenager, they are able to reduce harmful behaviors among teenagers. And what are the harmful behaviors? Like violence and drugs, taking illegal substance, as well as suicidal and teenage pregnancy. So what are the 4 key moments that parents need to spend? I call it parental availability. Number 1 actually is early morning. Number 2, after school. Spending time after school to hear them, what happened in school. Because after that golden period, you miss the boat, they wouldn't want to talk about it anymore, right? Number 3 is dinner time. Very important. And last but not least is bedtime. Spending time with them, praying and talking to them and listening to them. So let me highlight the 4 factors to build the emotional garden of resilience for a teenager. Number 1 is a strong, safe, secure family environment. And what do you mean by safe? Not just physical safety, not just a roof on top, but provide an emotionally safe family environment. Emotionally safe, they don't feel they're being condemned, they don't feel they're being they're being compared. So they are being supported, they're being encouraged, being affirmed. Right. And that also comes with a strong marriage. Very important. So number 2 is to provide the input for the emotional needs of a child. And let me quote Dr. Larry Crabb, a clinical psychologist, who shared that there are basically 3 important components for a child emotional well-being. So listen to this, very important. Number 1 is parents need to provide unconditional love and acceptance. Unconditional love and acceptance. Unconditional meaning what? You love the child and accept the child for who they are, for their strength and their limitations. Even though they make mistakes, even though they screw up, even though they fail the exam, tell them you still love them, you still hug them. So number 2 is to help the child to develop this thing called personal significance and personal worth. Meaning that help the child to feel that they have worth, they are significant, they are somebody. Yeah. And give you an example, sometimes if I have time, I try to say goodnight to my children, and I will tell them 3 things. Yeah. Number 1, I tell them daddy love you. Number 2, I'll tell them you are special. And number 3, God has a special plan for you. Yeah. So now number 3, the components for the emotional garden is mentoring. Every child, every teenager need a mentor, and there's no question about it, and there's no two ways about it. And mentor can come in the form of a parent who are available to guide the journey, as what Sifong has shared. Number 2, it can be a school teacher who show concern. Yeah. It can be a coach, a music teacher, a sports coach, or it can be a senior person a few years older than you who can guide and share. Last but not least, the 4th component is the spiritual well-being of a child or teenager. As parents, I think we need to provide the environment to help the child to question big questions, deep questions like the meaning of life, purpose, and the purpose of life, and to help them to understand the truth of their very existence. Yeah, the truth of their very existence. And why is it so important? Because they need that truth to protect them, to shield them from all the lies that society will throw upon them. Yeah. So we need to prepare them in terms of spiritual well-being as well. That's
Wow,
all.
so many golden nuggets. The good news is, parents, this video clip will still be available on our Facebook. So if you need to hear that all over again, you feel free to do so, yeah? But really, really good. 4 factors. Let me recap that: unconditional love and acceptance. Every teen needs that. To feel personally, to feel significant and worth. That's important. And to have a mentor to journey with them, even as they go through this developmental stage. And finally, to be able to ask important and deep questions so that their spiritual well-being is taken care of. Thank you, Dr. Vincent, for sharing these 4 very important factors to help our teens have emotional stability even in their lives. So our mission here at Focus on the Family Malaysia is to help families thrive by focusing our efforts on doing preventive work. So it's my privilege to share with you a new program that my colleagues are working to deliver next month, called Raising Resilient Children. I really love when Dr. Vincent talks about protective factors. Yeah, so these are protective. How do we protect? I prefer the word protect over prevent. I like it. Thank you, Dr. Vincent, for that word. So details are on the screen right now. And the good news is that registration opens today. All right, so happening on 29 April 2021 this year. Yeah, this program is for parents of children ages 9 to 16. Through this virtual workshop, we aim to help parents, number 1, understand common stresses that children face. Number 2, apply parenting principles to help build your children's resilience and confidence. And number 3, to apply techniques to help your child cope with stress. So if you're interested, feel free to click on the link provided in the comment section to find out more. Now, for the moment, I mean, we've been learning really, really good golden nuggets from all 3 of our panelists, but now our panel speakers will be answering your questions. So if you have questions, we have a lot. I see a lot of questions that have come in, but if you do have questions, please continue to submit them. Yeah. And we will be extending Q&A by 10 minutes. So we will end by 9:40. Okay, so here we go. First question. All right. This question is by Ian Chai, all right? The child is age 12. And there's another child that's age 15. Okay, so I'm just going to combine these questions. Yeah. Heightened emotions and agitation. Okay, this is what the question is about. Yeah. So this 14-year-old didn't seem to have much problem transitioning, but the 12-year-old has been having heightened emotional reactions for the last 2 to 3 years. Is this normal, and how do we handle it? Hang on. Yeah. So what I understand is that they have 2 teenage children, right? One is 14 and one is 12. The 14 seems to cope well, but the 12 is the one that's having heightened emotional reaction for the last 2 to 3 years. All right. And there's this following comment. Daughters, by the way, the age 12-year-old, they are daughters. Both children are daughters. The 12-year-old often is rude and frustrated with homework, for example. Both children feel the need to make sure they do well in school Yet the 12-year-old tends to have meltdowns and emotional issues with the homework. Okay, and this other parent is saying that the 15-year-old is always agitated, has been going on since he was 12 years old. So over here we have two questions that we're combining because of this agitation. Yeah. So the first child is a 12-year-old girl, and the second child is a 15-year-old boy. Yeah. So maybe we have Miss Law. What do you think about this situation? How can these parents help their child?
Okay. Yeah. I think like what I shared earlier on, parents want to find out first from the child what the child is experiencing. So parents can kind of like ask, I noticed that you are agitated most of the time. Yeah. So may I find out what is bothering you? Yeah. So parents can maybe try to find out more from the child first. And then parents could also, because I see that you are also mentioning about the schoolwork. So perhaps you might also want to ask whether the schoolwork is a lot, and if the child is able to cope with the schoolwork, and yeah, whether that is the source of stress that the child is experiencing. Yeah.
Okay,
I
thank you,
think
Miss Law.
that's the first step to communicate with the child and find out from the child, encourage the child to communicate more and let you know, well, what she's experiencing and what could be the source, of her stress.
All right, thank you, Miss Law. Also, I'm just wondering, this is my just being curious, yeah. Because the first question, there's two sisters, right? So would there be this scenario where there is comparison between siblings? That could this be something that we need to look into? Comparing two siblings, because they're two girls, they're
Yeah.
quite similar in age.
Yeah, but Dorothy, I think we need more information from the
Ah,
parent in order
right.
to have this postulation whether they are also sibling rivalry, which is happening there.
Okay.
Mm.
Thank you, Ms. Law. Okay, moving on to the next question. Okay, this one is by Carol. All right, the child is age 17, and then there is this. There's another question also that is submitted by Winnie. All right, the child's age is 13, and this question is about self-worth and esteem. So Carol is saying that. What are some advices for us as parents to walk alongside with a 17-year-old young lady who struggles with self-worth, especially related to physical appearance, such as overweight, among a group of extremely slim friends? And Winnie is saying this: my son is 13 years old and he's struggling in his studies. This makes him very low self-esteem. What are some practical things to encourage? I think I would want to separate this situation. Yeah. So let's Mrs. Tan, let's go with the first question first. Yeah, the girl that is struggling in the area of physical appearance. What would your response be
Yeah, I
to
think
this?
this is actually a very common problem with young girls. I have sat with some beautiful, capable young girls, and they are struggling. They don't love themselves. When I ask them, can you just list down what you love about yourself? They said nothing. And it shocks me. But, the peer pressure is so intense out there. And especially when they're in a group and they feel that there is something about them. And this could actually be linked to messages they have heard. When I say messages, I don't even mean spoken messages, but sometimes what they perceive, even growing up and in with their friends, perceive rejections. In schools for young girls, there is always this thing about wanting to belong to who you perceive to be most popular. Very often in schools, we have what we call pecking order, right? You understand the pecking order? It's like some people are like very popular, Everybody wants to be their friend. And so when you do not belong, you begin to feel that you're an outcast. And then you wonder whether it is because of how you look, because of how you talk, or because of who you are. So just for parents to come alongside and just telling them, no, you're beautiful, doesn't help because they cannot hear that. You say something, but they are hearing something else. They will just tell you, no, you're just trying to be nice, right? So just being loving and then maybe learning to get to know a few of their friends who are affirming, who are supportive, may be a good step. So as parents, even getting to know your daughter's friends may help. At 17, sometimes they may not want you to know their friends too, right? So just being understanding, being there, but don't rush in to say, no, you're beautiful, no, you're all right. Doesn't always help. Yeah, because they hear a different message. Because what is important, as we mentioned earlier, is the voices they hear from outside, the perceived messages they're hearing. Yeah, and social media, their friends are sending all kinds of messages about how they should look, how they should talk, how they should dress. Remember, we mentioned earlier, the sense of belonging to a group is so, so important. Yeah.
So what I'm hearing, Mrs. Tan, you're saying is that to listen to the child instead of offering advice, offering to save your child from that by saying, no, it's not that's not how it is.
True.
Is to listen first so that your child feels heard and seen, at least by the parent, and supported.
Yes.
With their feelings validated as well. Thank you, Mrs. Tan. Now
And
let's look at
Can I mention one other thing that is
Sure.
so something that I really feel very burdened about? You know, I think even amongst us adults, I think we should also refrain from making a lot of appearance-related comments about people. And that sometimes has an impact on the teenager. You know, sometimes we look at TV shows, we look at people walking past us, and, you know, in our culture, it's so common, so often to make appearance-related comments. Have you ever gone to a Chinese New Year dinner? And everybody is telling each other how, especially now after MCO, right? When you meet up, everybody is telling you that you've put on weight. Have you sat at home and done nothing except eat? So I think we all need to refrain for making appearance-related comments. You know, so for your 17-year-old in your home, it does not help at all. For all growing up young girls and boys, this kind of comments do not help.
Okay.
Right.
I just want to add a little bit to Mrs. Tan and Sit Fong to that question about self-esteem. I think as you know, as we know the environment that the teenager out there, we know they can be so challenging, can be so. I mean, if you have a healthy group of friends, you know, it's very good. As what Mrs. Tan said, you need that a supportive environment, supportive friends, yeah, and you need to differentiate from those that can be hostile and can be comparing. So I always believe that home, you know, family, you know, home should be a place of refuge and a place of a shelter, you know, for that teenage to come home to be able to share and cry, have a shoulder to cry on, and then it's a place where they can feel accepted, yeah, for who they are. And one thing is about self-esteem is, you see, adolescent always is a time where they are searching for their own self, their own identity, who they are and who they belong to, and they need to develop this sense of self, where so that their sense of self-esteem, you know, should be multifaceted on many aspects, you know, because I mean, not on the outer appearance, you know, not on your, but on the inner self, or the inner beauty, you know, or the inner ability that you have. An expert once said that, you know, you need to help the teenager to develop multiple multiple aspects that build sense of achievement in them. You know, they're developing skills, social skills, developing certain hobbies. You know, they can, or it can be musical skills, it can be dance, it can be drawing, it can be sports, and many more. You know, it can, now you can be a YouTuber, you can post some very interesting YouTube, you know, video skills, so that the child, when you have all this insult upon you that throw on you, all these lies that throw on you from your peers, you know, you still have something that you have in, you know, that, hey, I can do this, hey, I have this ability, you know, I know I don't really care what, you know, what they're talking about, what they're commenting about my appearance. So in other words, in summary, you need to help the teenager to develop a multiple aspects where they can feel they have ability, and of course coupled with unconditional love, you know,
Right.
at home.
Thank you, Dr. Vincent. Thank you. Yeah, definitely building that garden. Remember, we're all tending to that garden. Yeah. So giving them help that will help them have this emotional stability themselves. Okay. So we do have many more questions that are coming in. So right now we will only allow one person to answer one question. All right. So that we don't so that we can answer as many questions as possible. All right. Now this one question by Pei Chen Chu. The child is age 19. Ms. Law mentioned sense of belonging and sense of self. If this is not developed by the age of 19 or even early adulthood, what happens then? Maybe Ms. Law, yeah, since this question, could you take this question?
Yeah, okay. So what happens then is a lifelong quest. So if it doesn't happen in early adulthood, then it might still happen in later adulthood. And I want to maybe just emphasize again what Dr. Vincent said just now, because Dr. Vincent said it very well. The sense of belonging starts from the home. I think the home is the fundamental place where a teenager can feel belong to. So try to really establish connectedness at home. Try to have special time for communication. And I think, you know, it's a good time to usually talk to teenager when you're driving in the car, because normally, you know, that's the space that they are in, and you could start talking to them, ask them about how are things in their life. So the connectedness is very important. So that contribute to sense of belonging. And the sense of self, I totally agree with what Dr. Vincent said just now, is multifaceted, and it shouldn't be just focused on what is external, not just accomplishments. It can be also what is inside the person, you know, like, hey, I'm a kind person, I'm a very helpful person, I'm a friendly person. So it's also important for parents to guide their teenagers to look at what is also inside of them, you know, that they appreciate themselves for who they are. So this also is a very strong component to build one's identity and the esteem of oneself.
So this is building character, good characteristic traits that will last with the child, right?
Yeah.
Okay, thank you, Miss Law. Now, next question by Jenny, yeah? Also directed to Miss Law. I tried asking my teenage son what is wrong, but he refused to open up. What to do?
Okay. So yeah, you could try those conversation starters, and if they still refuse, then maybe you can see whether they would like to talk to somebody else, or you can ask, you know, somebody else to try talking to them, perhaps the siblings, or perhaps some other significant adults like uncle, aunties that your teenage son is also close to. Or you can even suggest them, hey, maybe you want to talk to your school counselor, you know, if you don't really want to talk to me, and that's okay. You can talk to somebody else that you are comfortable with.
All right. So it doesn't mean that the parent has to be the person that the child talks to. The child could actually reach out to other
Yeah.
people that they trust. Okay. All right. Now,
Yeah.
now we have, okay, let's move on to the next question. We've got 5 more minutes. All right. So question, this is by Jane, age 11, the child age 11. Yeah. Yeah. Dr. Vincent, my daughter's 11 years old. She always has hysteria and painted epilepsy. How to help her? Painted epilepsy, huh?
Right.
Okay.
Thanks for the question. Uh, Actually, there is a difference between hysteria and epilepsy. So I'm not sure what was the term. Maybe Dorothy, can you repeat the statement?
She always has hysteria and painted slash epilepsy. The word painted is the painting kind of painted.
I see.
Oh, sorry. It could be fainted. Yeah.
Painted.
It could be a typo. Yeah.
Right.
So
Okay.
how can we help her?
Yeah. First of all, hysteria itself is a psychological condition. Yeah. Whereby sometimes the child or teenager may be seen screaming or shouting or behave in a very unusual manner. Yeah. Crying inconsolably. Yeah. And usually it will subside. After a while, like half an hour to 1 hour. Yeah, and usually it's related to some underlying trauma or distress, that has been repressed, or kept inside and bottled up. So just bottle up a lot of emotion, yeah, and then it just kind of release, yeah. Whereas epilepsy is a medical condition, it's a brain condition due to abnormal signals in the brain. There were a lot of abnormal and excessive signals, and sometimes resulting in uh, rolling of the eyeball, or drooling of saliva, or clenching of teeth, or muscle jerks. So I think, first of all, if the child shows such a intense change of behavior, the child should be brought to see a doctor immediately, because we cannot afford to miss epilepsy. Yeah, because prolonged epilepsy can cause brain damage. So bring the child to see a doctor, to see a neurologist, or even start off with a normal GP, general practitioner, and make sure it's not a brain condition. And if it's a hysteria or psychological distress, then refer the child. I think it's 11-year-old, is it? Yeah.
Yep.
So to see a counselor, to start off with a counselor, yeah, and then talk to and explore what happened in the child's environment, school environment, whether there's any peer pressure, is there any bully, and is there any stress, or any stress from maybe teachers,
Right.
giving a lot of homework. So uncover the stress that causes the psychological distress.
Okay, so the most pressing need would definitely be to see a neuro specialist first because of the epilepsy, right, Dr. Vincent?
Yeah,
Then
that's
after that, follow up with perhaps counseling. Okay, next question from Christina Kong. Should we be alarmed when my 11 years old girl revealed of having suicidal thoughts once before during MCO last year? After much talking with us, she is fine already so far. Is there a need to still seek professional help? So the girl is 11 years old. Perhaps Mrs. Tan can take this question.
I think if it's happened once, I think more importantly, as been mentioned by Dr. Vincent and Sid Fong, I think it's for the parents to actually be always alert, to always be present, to continue just being with her, to talk to her. And then if you notice that she might be showing signs of, behavior changes, then you may suggest that you can bring her to see a counselor. Yeah. But otherwise, I think it is just once before the MCO. It could be something she picked up from a friend. It could be something due to a certain incident that caused her a lot of distress. But I think more importantly, it is for the parents to be very present and to offer that safe space to show that you are with her. I think that's more important. And then in the course of your conversations, you could suggest to her, would you like to talk to someone else? Yeah. Because even at 11, they sometimes will not want to talk to a counselor because sadly, I mean, there is still this stigma that if you see a counselor or a psychologist or a psychiatrist, something is wrong with you. Yeah. So perhaps for this particular time, just the parents lovingly show unconditional love and listen and be alert.
Thank you, Mrs. Tan. Now we are going to the last question, and I would like this question to be answered. This question is by Jean, my daughter, 14 years old, told me that she needed help, and I sought professional help for her. In fact, she had a session today. How do I know if I'm doing enough for her? Because I really want parents that are tuning in tonight to really hear that, are they doing enough? Perhaps we can hear from Miss Law.
Okay. First of all, I want thank you for sharing that piece of information with us. I think the parent is already being an attentive parent here by you attending to your child's need and eventually even initiating professional help for her. This is already the step that you are trying to support your child, as much as you can. So parents sometimes would struggle with the questions, am I doing enough for my child? So I think it is okay to be an open communication with your child, with your teenage child, asking them, what else do you think you would like mommy or daddy to do? What else, how else can we support you? So if you can ask them that questions, so perhaps they can feedback to you, hey, I would like, you to support me more in this area, that area. So that would be a feedback system that you have with your teenager children. And then that might help you to know, is there any other area that I can still support my teenage children here?
It's to really, really good golden nugget to ask your child, what else can mommy, daddy do? Thank you so much, Miss Law. So big thank you to Dr. Vincent, Miss Law, and Mrs. Tan for taking time to share your knowledge with us on teenage mental health, especially in the area of depression and anxiety, and how parents can journey with their children and what they can do to increase their children's resilience. So this is the right time to spam, all right, the reaction buttons on our comment area. Leave a note to say thank you to our panel of speakers this evening. So thank you, Dr. Vincent. Thank you, Miss Law. Thank you, Mrs. Tan.
Thank you
for being with
Dorothy.
us.
Thank you, everyone.
Thank
All
you.
right.
For joining us.
Okay, so give me 2 more minutes of your time. Okay, give me 2 more minutes. Yeah. We know that journeying with teenage children that are facing mental health challenges is no easy feat for any parent. You need all the support you can get. So we at Focus on the Family Malaysia have a team of professionally trained counselors that are ready to lend you a listening ear. Reach out to us at family.org.my/gethelp. And I'll leave us your contact details. Our counselors will get in touch with you. We also have prepared some additional resources, such as articles and books to give you more handles as you navigate parenting teenage children. So these are the books that the team has curated from our online bookstore. And in conjunction with this event, we are giving a 10% discount for any book purchase. The discount code is Teen Mental Health. It's quite long, but Teen Mental Health, all right? And it is valid until 5th April. First-time purchases will get an additional free storybook. So all these resources will be available at this link, family.org.my/teenmh. Okay, the discount code is Teen Mental Health. The link is family.org.my/teenmh. I'm sure you will see it in the comment section. But yes, final reminder, if you are serious about raising resilient children, let us continue to journey with you. Sign up for Raising Resilient Children at family.org.my/ resilient children today at only 30 ringgit per registration. I peeked at what my colleagues were saying in the group chat, right? We already got 6 people that have signed up. Very good, very good. Okay, that's all we have this evening. Thank you for tuning in and good night.